FORA.tv. The world is thinking.
The second question in the book is, how do we know smoking's dangerous? And it seems almost a crazy question to ask in 2007. But in the middle of the 20th century, as rates of lung cancer rose, cigarette smoking was only one of several hypotheses about what was causing this dramatic change in patterns of disease. Some of the epidemiologists, the early epidemiologists who worked on the problem, said, I was betting it would be cars. If you look at the graph for cars, it looks very similar in many ways to the rise in cigarette smoking. One of the epidemiologists said paved roads and asphalt, which puts a lot of toxins into the environment, said it was cars and paving roads, not cigarettes. And even though there was always a lot of concern about smoking and health, the strategies, the scientific strategies for running that to ground are, in my mind, one of the great accomplishments of mid-20th century medicine and science. And it involved really creative thinking. It was around a time when people were starting to do randomized clinical trials, and they realized that you couldn't divide up a group of kids, half of whom you would say, you become smokers, and half of whom you would say, you cannot be a smoker, and follow them forward the way we would if we were randomizing a trial. So Dahl and Hill in Great Britain, and a surgeon in St. Louis, Evarts Graham, and one of his medical students, Ernst Winder, start to do these studies where they're tracing people forward that are carefully matched, smokers to non-smokers, and then seeing what happens with their health. And it's really the basis today for what we would call evidence-based medicine. So again, I find in this story sort of structures that are basic to the history of the United States throughout the 20th century. And by 1954, 1955, the evidence that smoking caused lung cancer was very, very significant, if not overwhelming. So what did the companies do? They sponsored ads that say, more doctors smoke Camels than any other brand. They had ads that say, play safe, smoke Lucky Strikes. They had ads that said, you know, just what the doctor ordered, L&M's new miracle filter. And it was very brilliant. And they said, you know, there's not proof. They sponsored science that directed attention away from the cigarette. And so I also find in this history the origins of our scientific disinformation campaigns and the way of manipulating science. And in many ways, the industry developed the most significant attack on the normal workings of science that I think we've probably seen in the 20th century. How can we disrupt the science? That was the question. On the one hand, they were telling the public, there is no proof, but we have filters. On the other hand, I found, and now we have many documents about what the industry knew and when it knew it, and this is really what I testified in the trial about. I found one document, R.J. Reynolds, 1953, and it's by a scientist named Claude Teague. And he says, we've been experimenting with the pH of filters, and it turns out by varying the pH, we can make filters turn any color. And he said, we've found with focus groups that if we make the filters turn yellow or brown, people are convinced that they're more effective. Unfortunately, we have no way of removing the known carcinogens, but we believe this discovery of pH in filters will be an important marketing tool. 1953. So, and literally, there are hundreds and hundreds of incriminating documents from the industry, laboratories, and scientists during the same period that they're writing to doctors saying, make up your own mind. This is really a clinical issue. Some patients perhaps should be told to switch to our brand. But they wanted to maintain smoking within the domain of individual clinical judgment. as opposed to the categorical finding that smoking causes lung cancer. And this eventuates in the first Surgeon General's report, which in my own mind never would have been written except for the disinformation campaign that the industry was waging. And finally, people in public health said, if we don't pull independent scientists together and have them make a definitive statement, this controversy will go on and on. So the second section of the book is this question, how do we know? And it really documents this process for knowing.